friends, and I am here again with some new questions which I remembered in the Neet 2019. And the first one is the best approach in the treatment of chronic SIADH syndrome of inappropriate antidiuretic hormone secretion is. So the answer is tolvaptan, which is also known as vasopressin receptor 2 antagonist. And the next question is a drug used in estrogen dependent breast cancer, and the options were estrogen, clomiphene citrate, tamoxifen, adriamycin. So the answer is tamoxifen, and which is a SERM selective estrogen receptor modulator. Now the very easy question I remember, antidote for scorpion bite is prazosin alpha agonist, alpha blocker, sorry, alpha blocker, and multi-site trial is done for how much years? This is a question of clinical trials, and the answer is 3 to 5 years. Now pain on injection is seen in all except, so the answer is ketamine, which is also a general anesthesia. And again, next question I remember is thrombosis of posterior inferior cerebellar artery causes. So this is very much frequently repeated question in various examinations, and the answer is lateral medullary syndrome. And the last one I remember is which of the following drugs is used as anti-smoking agent, and the answer is varenicline. Varenicline, also available in the market as a name of Chantix. It is also known as partial nicotinic agonist. Thank you, and be updated because I'm also bringing up with some more parts of, as I'm memorizing the all of the questions. I hope you like it.